So, when treating a wound that is severely bleeding, it's important to follow these 10 steps in order to help the patient out. So number 1, if gloves are available, put on gloves to help treat the patient or victim. Number 2, remove any clothing from around the wound so that you can easily access it. Number 3, check the wound for any foreign objects. And if there are foreign objects, don't remove them because they might be affecting the blood flow. And removing them can cause harm. And then step 5 is to apply pressure to either side of the wound. Can you apply pressure right here? Number 6, look around for objects that can help apply pressure. And if none are available, in which this case there aren't, it's important to just use your hands. After this, step 7 is to call 911 and alert emergency response services and tell them about the current situation that's going on. After this, it's important to secure the dressing around the wound and then apply a bandage to the wound. Hold this. So for this method, I'm using the figure 8 to secure the dressing around the wound. All right, so it's important that when you're securing the bandage around the dressing, to make sure that it's tight, but not too tight to cut off circulation and blood flow to the rest of the arm. To check to see if blood is circulating properly, squeeze right above the fingernail and check for the redness. The redness means there's a buildup of blood there. And if color returns quickly to it, that means there's an adequate amount of blood flowing back to the arm. Now, after step 8, securing the dressing, we need to go to step 9, which is treat for shock. So when treating your patient for shock, it's important to calm them down or help lay them down so they can relax. And when you get them laid down, and you need to prop their feet up to restrict blood flow from the rest of the legs, unless the legs are injured. If the legs are injured, don't move them. Now, number 10 and the final step of this is to just support the injured area and monitor the level of response from the patient. So check their vitals, make sure they're still conscious and breathing, and wait for emergency services to reach you. Now, for removing the gloves from your hand, it's important not to get any on you because it might transfer disease, or you might have other material on your gloves that might spread infection. So 2 rules to really follow when removing gloves. It's glove to glove, skin to skin. So to start, we're going to take off the gloves by first pinching around the collar of the first glove and getting your fingers underneath like this and slowly pulling them off like that. And then without touching it, ball the glove up in your other hand like this. And then take these 2 fingers, work them underneath the collar of this one, and work it loose like that. And then you can safely dispose of the gloves